Working together, partnerships, networks and consortium. Disabled trustees and staff lead the work of the Alliance for Inclusive Education, but Alfie also works very closely in partnership with allies and supporters.
I think one of the interesting things I've learned since I've started working with Alfie is the concept of working with allies, and particularly as we're working with a lot of young people, the role of parents is really important, and the aim of the organisation is to connect with parents rather than not engage with them and just see them as carers who need to go to a carers organisation or perhaps an obstacle to their young person's development. So we want to engage with parents and work together with parents in the interests of all of us as disabled people, and not live by the divides that are created by government structures around you're a carer, you're a disabled person, and that we're separate. We're not. We're in this together.
In the past, there has been a separation, and for many parents of disabled children, it hasn't been their experience of just naturally being together. So I think it is essential to share the experience that disabled people have had with parents of young disabled children, to know that there is an amazing future and that life is just going to be absolutely fine, because they are able to see the examples and the positive way in which disabled people take part in community and work and employment and organisations.
In terms of partnership working, we certainly feel that the disability sector, DPOs, should sort of span their networks and also look at forging sort of working relationships with the wider voluntary sector. So not just the wider impairment Pacific sector, but looking at the more sort of the non-disability sector as well, such as the youth services, older people services, the leisure services, but also working with the local voluntary council as well. Forging partnerships of that nature will help to strengthen our voice. It helps us to kind of take our message out into the wider mainstream as well. And I think very often DPOs can get caught in this space where they're working in isolation. The only people who know of their existence are the immediate service users, but the wider community don't know that they're there or don't know what they do. I certainly feel that DPOs should sort of branch out, simply because disabled people themselves, use wider services in the community. Disabled people don't just use those services that are provided by DPOs.
After a strategy and planning away day, trustees and staff at Disability Cornwall agreed that good networks were key to future campaigning and disability rights work.
I think we rediscovered the fire in terms of campaigning. We identified that as a really fundamental reason for us to be here. It's really important to get that space sometimes to think about what it is we're here for, how can we achieve what it is we came together in the first place to achieve, and what mechanisms do we need to put in place to achieve that. And that probably influenced our shaping of our ULO network action plan, which was ultimately successful. And a key element of that ULO network is to identify a strategic way of getting the voice around disability issues out there in a more strategic way and to have more impact. Smaller organisations might find that their voices becomes diluted, or it doesn't have the impact that it needs to get heard at strategic levels. By joining together, particularly when we're kind of under threat in terms of our funding, sometimes we can feel threatened and not sure how to put our voice across without undermining potentially our funding, for example, and it's important that we share that responsibility among us. And that's one of the reasons why we're doing the ULO network, to share that voice, to share training, to build capacity, to look at partnership opportunities, to engage smaller organisations with awareness about tendering and procurement, which is a new way of funding, whereas they might not have access to resources to learn about it. We've been proactive there as well. So it is really important, now more than ever, that we join together.
You can have organisations that are providing services for disabled people that don't necessarily have to be all disabled people themselves. There are ways that people can work together in partnership and relationships, for the good of all. So I think, having consortiums and having partnerships can definitely strengthen organisations, and it's clearly the way forward, and it's something that we're trying to do here at Disability Cornwall.
The Council of Disabled People, Warwickshire and Coventry is a disabled people's organisation working from a disability rights perspective. CDP is one of a number of user-led organisations working in Coventry. In 2009, CDP suggested setting up a local consortium of user-led disability organisations.
What we were proposing is that we get together, as opposed to just us working in isolation, that we actually work together and bring in our individual strengths. And whilst we've got this pan-impairment approach towards things, so we also have to remember that we're not experts in every single field. We don't represent every single disabled person. There are other groups out there that can form part of a consortium which would make us stronger.
CDP invited a consultant from another DPO to facilitate the setting up of the consortium.
At the time, there was CDP, Council of Disabled People, there was the Carers Centre, Grapevine, which is a local organisation of people with learning difficulties, and Coventry Mind came in and were interested in getting involved. And it was quite productive, and as a consequence now we've got a memorandum of understanding. We've had a few meetings together with commissioning, etc., to talk about the future of what we call the CULOC, the Coventry User-Led Organisation Consortia. And we've had a new organisation that's joined called AIMS that is involved in giving a voice to people with mental health issues. So we're kind of hopeful for the future on the CULOC, and that things will progress and we'll be able to work together and deliver projects together and tender together in the future. Some of the organisations that are involved may not have like a majority of service users or beneficiaries on their committee. They will have some, but not necessarily, the 51% or 75%. They may have under 50%. But actually, the way they work as a group and as an organisation is very user-led in their approach. And by working with us, we hopefully will support them to kind of develop to become more user-led. So there's that kind of developmental type approach towards it as well.
How useful was it to have meetings facilitated by someone from another DPO?
Having a consultant come in who was from a disability equality type background and had that level of understanding, it brought something added that just wouldn't have been there if you had have brought in somebody as a consultant who could have gone through the process of this is how you do it, but wouldn't have brought that element of understanding in with them. So I think that was very useful for us to have that support, and it also reinforces the message about disabled people are able to do these things for themselves, and their organisations can take a lead, and we can act as the consultant instead of having to look to what's perceived as to be the non-disabled community to do this work for us.
How is CDP benefiting from the new consortium?
We've developed, or in the process of kind of developing, new relationships with other organisations and groups, and I think already we're starting to see some benefits starting to come from that, where we're actually able to work together and share some of our resources and knowledge base. Our aims are to support disabled people and to try and fight for equality for disabled people, but in order to be able to do that we have to be able to exist as an organisation, and we need to bring in funding. And we have to look at how we do that, how we work, and some of the ways of doing that is to work together with other groups. So you can stand in isolation on your own, you can try and survive on your own, but obviously you become weaker. You can become weaker in that way. Working together with other people and being able to develop relationships with other people can strengthen you as an organisation in order to be able to achieve the outcomes that you want. And to a large extent, all the organisations that we're working with want the same outcome. We want equality. We want decent quality of life for people, disabled people, and for us to have equal opportunities in life. So we all share that commonality together. It's just about how we bring that together and work together.